Hand therapy services during COVID-19. Despite the outbreak of COVID-19 pandemic in Doha in March 2020, patient care in hand therapy services continued with outpatient and inpatient through fewer face-to-face sessions and more of telerehabilitation through VC consults. We took the utmost precautions, followed strict infection control guidelines, and continued to develop and provide our services. We used the acronym COVID to represent what we have achieved during the pandemic. C for continuous patient care, O for outpatient, inpatient services, V for VC telerehabilitation, I for infection control guidelines followed, and D, development is still ongoing. C for continuous patient care. During the first few months of pandemic, hand therapy outpatient services were concentrated on urgent, complex, and post-operative cases. Treatment of non-urgent cases was reduced and delivered to telephonic or video consults. All incoming referrals were triaged by three pregnant staff who were working from home and were communicating with patients and doing virtual sessions for the non-urgent cases. Initially, the hand therapy services at HMGH Hospital were moved to RH as the hospital was being prepared as a COVID-19 facility. However, they returned back to HMGH in May. Alcor Hospital coverage was reduced to fortnightly during the peak of pandemic and has now returned back to its pre-pandemic coverage of once weekly, addressing the needs of OT services in the said city. Due to the reduction in the services, some of the therapists and assistants were delegated to triage services at the hospital entrances. However, by now, they have returned back to hand therapy services. O. Outpatient, inpatient services. Outpatient, face-to-face treatment, in-person hand therapy sessions continued even during the pandemic. From March up until home programs, handouts, and pamphlets were provided to our patients in order to have an optimum outcome. Patients were provided with consumables such as therapy, exercise balls, and Velcro boards in the latter phase of the rehabilitation. Inpatient. With the transfer of plastic surgery, inpatient units to the new surgical specialty center were provided with hand therapy to post-operative patients began to be delivered there from March 2020. We are currently covering 10 units. With the needed equipment and materials in place, this is our therapist working in our inpatient. VC and telerehabilitation. Video and telephone consults began to be delivered to the non-urgent and high-risk outpatients at the beginning of the pandemic and are still ongoing. All therapists are presently involved in this process of seeing new patients and follow-ups. So far, this has been a successful way of assessing and providing home programs. OT hand units has seen the following number of outpatient and inpatient. Here is the following statistic. As you can see, during the peak of the pandemic, the number of our patients are less, and as gradually it increases up until present. The number of visits and sessions gradually increase. Even in inpatient stats, our visits and sessions gradually is increasing as we open up with the restrictions. I. Infection control guidelines followed. Strict infection control measures had to be followed and monitored during the pandemic. There has been a major change to the physical structure of the unit. Only one patient was allowed to be seen in each room for patient and staff safety, as against multiple patients being treated in the same room prior to. Special shields were made by staff as well as the engineering department to be used for patient safety and staff safety. D. Developments ongoing. Staff continue to work on the annual objectives of developing clinical protocols, educational pamphlets, and case presentations. Staff is acquiring continuing education through webinars as resume case review activity through the online Microsoft Teams application. This is one of the print screen of our case review which resumes last July 1, 2020.